and welcome to PhysioPod Plus, the podcast where we dive deep into the evolving world of physiotherapy and stroke rehabilitation. I'm your host, Asalet Aybükegül, and today I have an amazing guest for you guys. I'm truly excited to share the mic with someone who inspires me and so many others in our field. Joining us is Dr. Karen Borschmann, a senior researcher, clinician, and one of my amazing supervisors here at the Florey Institute. Karen has played a key role in groundbreaking work in stroke rehabilitation, especially in creating responsive services for younger stroke survivors. Before we dive in, I just want to say how honored I'm to be part of the Young Stroke Project team with you, with all team, and how thrilled I'm about the work we are doing together. Karen, welcome to show. Welcome to the PhysioPod Plus. It's such a pleasure to have you here.
Thank you very much. I'm really pleased to be here too.
Yeah. Karen, I would love to start very beginning because I know every great research tutorial has a story behind it, and I'm curious, what is the story here? Could you walk us through the inspiration and the journey of creating the Young Stroke Service? How did the idea first come about? And what has it been like along the way?
Yeah, it's always an interesting story to know where things come from. But I'm a physiotherapist, and I've been working for about 25 years in the field in various different responsibilities. But even before I was a physiotherapist, I did a lot of support work, both here in Australia as well as overseas. And throughout my experience of working with people who have got disability, either being born with it or experiencing it, such as stroke later in their life, I was always inspired to learn from people and then learn and think about how I, as a therapist or as a support person, could help somebody to live their best life. And then my journey into physiotherapy as a clinician, I always enjoyed working with stroke or working in stroke and learning from people who have got stroke, having great mentors who are years above me in terms of experience as well. But I was always challenged with not quite feeling that I knew enough or could. I always wanted to improve what I knew so that I could help other people to have their best life as well. So there's a lot of give and there's a lot of take. I became a stroke researcher after about 10 years of working clinically, and always I've had a passion and a vision to help people with stroke to navigate the health system better and to help to improve the health system so that it's not so hard to navigate the system. And then to improve the system as well, so that we can really start to develop services and develop the research and the evidence to know what is the best way to help people with their recovery. And so that's my interest, and that's where that's stemmed from. And I was lucky enough to be mentored through my clinical experiences, my clinician experience, as well as through my own PhD. Through some really inspirational people, both within Australia as well as internationally, who were all grappling with that similar vision and wanting to work together and learn from each other the best that we can. Because it's not just a problem in Australia, it's a problem around the world, and there's a lot of scope for improvement. And it's really, it's about time. For a long time, and we're doing it now. There's still so many questions, and I think the more answers we get, the more questions that we get. But it's a really exciting space to be working in.
Yeah, that's such a powerful story. It has so many experience, so many clinical experience, so many research experience, and I know you are an amazing clinician, amazing researcher, and I'm very excited to hear about it. And it really shows how listening stroke survivors' lived experiences can help build services that truly make a difference. And you can just feel whole person centered this whole initiative is. Now, I just want to clarify the terminology a bit before the dive into the young stroke service. I just want to talk about the young stroke survivors because we hear the term young stroke quite a lot, especially in recently, but it can mean different things depending on the context, actually. So when we say young stroke, then what exactly does that mean in a clinical sense? What age range are we talking about, and why was that specific cutoff chosen? Because I'm looking at the literature and always seeing different age ranges. In Australia, generally you prefer the 18 years old and 55, but other countries can use generally 65, or others can use 45. So we have very different age ranges for young stroke survivors. So where does the difference come from?
That's a great question. And it's something that we have been discussing within the research and the clinical world for many years, particularly with our colleagues who have who experience stroke themselves as a younger person. And for the purpose of our young stroke service, we often talk about younger stroke survivors because we know that that is such a challenge, and we don't want to exclude people, but we need to have some boundaries around what we do. We do know that younger people, younger adults, so we have 18 as the minimum age for adults for lots of different reasons. But within Australia, we do tend to go to around the 55, and that is on balance related to the cause of stroke, which is different to, often can be different to older people. Also that older people, particularly in Australia, who are over the age of 65, perhaps might be able to access different health services, or different, maybe not health services, but community support programs. And so there's lots of reasons to go a little bit older or a little bit younger, but on balance, we've gone with 55. And 18 to 55 is also the recommendation for the younger adult category, according to research definitions within the stroke recovery and rehabilitation roundtables that I've been involved in a few years ago. So using those definitions, that's the 18 to 55 is what we have at the Young Stroke Service. But it's a very good question, and it really depends what is the context that you're asking the question in, as to whether you might go for a bit of a younger or a bit of an older cutoff. I do know that in the United States, there's a program that I believe has a younger program for anyone who might have return to work needs, and that could be up to the age of somebody who's 75. So it's always very context specific as well.
That makes perfect sense. The age range really influences not just medical care, but also life goals, careers, and parenting. So many areas that need tailored approach. So it makes sense. And now let's take a step back and look at the bigger picture, because beyond just definition, there is growing concern about the possible rise in stroke cases among younger adults. And I know you and your team, you are always collecting some data from younger stroke survivors. And in the whole process, have you noticed an increase in stroke incidence in this group over time? And if so, what do you think might be driving these trends in young people?
Yes, there is an increase in the incidence of younger stroke, not just in Australia, but around the world. And we don't really know why. And that is one of the questions that we are exploring in some of our research collaborations. We know that the regular, or that the standard risk factors for stroke in some places is increasing for younger people, such as diabetes, heart disease, cholesterol, physical activity, and other modifiable risk factors. But in younger people, there's also a lot more cryptogenic strokes or strokes for an unknown reason. And that's part of what we do in the Young Stroke Service here, is to help people to better understand the cause of their stroke, or help their clinicians to understand the cause of their stroke. But overall, there is a lot of research to be done in better understanding why young people are experiencing such an increase in incidence of stroke.
Yeah, you're right. It's actually pretty alarming, isn't it? It's alarming. It's an emergency situation for younger people. And I think as a healthcare professionals, we really need to focus more prevention strategies that are tailored to younger people as well. It's just my thinking about this. And actually, this naturally brings us to rehabilitation needs. I want to talk now more rehabilitation needs of younger people, because younger stroke survivors often face very different life demands, going back to work, raising children, continuing their studies, social environment, and more. So, from your clinical and research experience, how do the rehabilitation needs of younger stroke survivors differ from those of older individuals?
Yeah, that's a great question. And that's a big reason for us establishing this Young Stroke Service project, because we know that particularly from Australian data, but from global information as well, is that health services are traditionally set up for older people, or that the needs of older people, and particularly around mobility goals. So, oh, fantastic, you can walk again, off you go. And that's a very crude description of it, but it does mean that they're much more focus on the more traditional medical model. The person's well again, or their health is stable, and they're able to start to regain some independence, and then the expectation is that they will continue to recover in the community with community supports, which are often physiotherapy, speech pathology, occupational therapy. And there are often time-limited access to services, and they might be goals more around potentially leisure rather than vocational, return to work and such. But as you said, the needs, or that the life stage that younger people are at, is very different to an older person. And also, younger people often will have more of the invisible disabilities or difficulties, such as the psychosocial needs, such as the brain fog, fatigue, memory issues, things that the more of a traditional health service might not be able to focus on, or maybe these issues might not appear until somebody is in a more challenging situation back at home, looking after kids, having to manage the budget, having to pay your bills, having to, lead a conversation at work, or whatever that might be. So a lot of the high level cognitive issues don't necessarily manifest themselves until after, or they might be issues that arise later on, after weeks or months after they've been in the hospital system. And quite often it is challenging to get back into the health system, even if you do recognise those issues. So there's sort of often no re-entry within the health system, or it's a very difficult re-entry. So I hope that's answered your questions. I could speak on this for a very long time, but yeah. So I think overall, it's traditionally things are built more for a medical model focused on older people's needs. And a lot of young people don't have those needs, or even through the best of the clinicians' abilities, they don't have the structures of the systems to be able to support people's individual needs related to their life stage, and they don't necessarily have the way to get back into the system when issues do arise.
Yes, Exactly. It's not just about getting function back. It's about reclaiming independence, identity, and often a sense of the future that can suddenly feel uncertain. So it is not just about getting function back. Yeah, you're right. Speaking of life after stroke, we know recovery has so many layers for every patient, for every disease. It can be physical, emotional, social, and I know you have been deeply involved in identifying some needs for younger stroke survivors. For you are called these needs as the unmet needs. And what are the unmet needs, and what are the biggest challenges young stroke survivors face, and how does it feel to be a voice for these needs?
Well, I'm probably not the best person to talk about being the voice for these needs, but I learn a lot from my colleagues and my collaborators who do have lived experience of stroke. And that's why what we do is so important, to work together in partnership with young people who have had stroke so that we can learn together and share and grow this space together. But we did develop what we're calling now the Young's Unmet Needs screening survey. It's now about there's 50 items on this survey that are grouped within 6 key areas, and these are issues that we keep hearing from stroke survivors and have been endorsed via a whole journey, I guess, of developing this survey, as well as ongoing clinical testing of this survey, and it's an ongoing space that we're developing. But the main areas are related to the body and the mind. So the physical recovery, as we've spoken about the social situations of people's recovery, their daily life, and their ability to be independent, or their learning to rely on others, which can be a really challenge, for people who have previously been looking after other people to now be having to look after themselves. Get support to look after themselves can be very challenging. Can be challenging at any age, but particularly for younger people. Relationships and the ongoing development of new relationships, as well as existing relationships, and helping people to understand their situation, their emotional needs. So, as you were saying before, their identity, but also that their mood and their understanding of how their changes after the stroke has impacted them, relating to depression, anxiety, anger and frustration. Then there's the information that people have as well. There's so much information out there. How do you know what's good and what's and so that's the main areas that people continually tell us that they do have unmet needs related to. And from our recent data, we collect information from people about their needs when they first join the service, and then also at follow-up periods as well. And we've got some recent evidence from the first 300 people who have come through the service that it's regardless of whether they're a younger young adult or an older young adult, regardless of whether they're in a metropolitan or a regional area, and whether they're sort of earlier or later after stroke, fatigue is one of the biggest issues, and how that impacts a life can be really disabling for some people. So fatigue, memory issues, return to work, and ongoing support to access services that they might not have access to. They're some of the key issues that are coming up in our patient population over the last few years.
Yeah. These recovery layers, so many of them, uh, are generally overlooked in maybe clinical settings, or maybe even in research trials. But we are now learning so many different and and new things from your research experiences. And these are very important, and it is incredibly meaningful because it's not just about function, as we said before. It's also about the dignity of the person and giving people a real sense of agency. So these are very important. And now I want to talk about service design for young stroke patients, because identifying the needs is one thing, but I know it is a big thing. But developing a service to meet them is actually another. So, and I know your team is doing both. So you are developing a structured service model for specifically for young stroke survivors. And what is the motivation behind creating such a tailored service, and why these services are so necessary in healthcare systems?
Yeah, so my research collaborators did a big scoping study at the start of our service, and where we looked at existing health services across Australia, just at a very high level, and then much more deeply across the two states in Australia where we're currently based, which is Victoria and South Australia. And we found that there were a lot of gaps within the services available. So within our model, we don't want to replicate services. If there's already a service which is available for somebody, that's fantastic, and we might help our patient to access that service or to get a referral into that service. But we do know that there are some really glaring gaps within the health services that are available for younger people, particularly younger people with stroke, especially around neuropsychology relating to memory and thinking, as well as the clinical side of things, where they also surveyed clinicians to know how comfortable are they to work with somebody who is a young person with stroke. And so we know from that from many different research and clinical data does tell us that around 50% of the people with stroke will have some kind of a communication and or cognitive difficulties. But from our evidence, only very few clinicians had been trained in actually being able to communicate well with people with aphasia. That's just one example of the gaps within the services, but also the gaps within the clinical capacity as well of the services. People wanted to be able to work with people with stroke, and every clinician is very dedicated to what they do. So it's not the issues are not so much at the clinician's level, but more at the broader health structures and the decisions, and what training is required and what mentorship is required for people who are working in what is quite a specialised space. I feel like I'm answering your question very broadly, but so and these issues are these issues are really important for everybody, every patient, regardless of their age. But because we had such an interest in young stroke, but also knowing what was important really broadly as well, it was just it would be a great disservice if those two issues were not really closely linked together. And so, sorry, I think I've lost the actual question that you asked, but it was about why this model and why. What has influenced us making the decisions to establish it the way that it was, that it is, and and we've also we're trying to think about how every health system is different, but what are the core issues that every health system could potentially learn from? So we're actually testing our model within two different health systems. So in Australia, the funding is for health is different between the states, and the structures and the decisions and the data sharing capacities and the medical records and all of those really health system generated issues are different between Victoria and South Australia. So we're testing it across 2 states to know, okay, what can we learn from those 2 different models that would hopefully help other health systems, other health services to understand what's important for success. And so the key underpinnings are the communication and inclusion, accessibility. And as I was mentioning, the aphasia training and making sure that all of our processes are designed from an inclusion perspective. And this has involved a lot of staff training for, even myself as an experienced clinician researcher. I'm continually every day learning more about this space. We're also critical to the development is the lived experience voice. So we've formed a group of 17 people who are our consultants from the lived experience community. So mostly younger adults who have had stroke, and some of their support people as well. We try to engage with, or we do engage our lived experience team on really helping us to see things from the patient's perspective. Me as a clinician, me as a researcher, I know certain things, but it is always better to have the patient's perspective as well. There's nothing that cannot be improved by seeing things from a patient's perspective, and not just checking with them at the end, but actually, making sure that people with lived experience are sitting at the decision table or having discussions around what's important, about how to frame questions, about how to ask questions, about which questions to ask, for example. So, so the lived experience, the communication accessibility, and then the ability to share or to capture and use patients' information with their permission, of course, in all of our health service evaluations as well, so that we can really have a really strong understanding of people's experiences across young stroke, so we can use this information for other research studies, but also to really critically evaluate the services that we are developing and learn from it and build on it and have a continual process to improve what it is that we're doing.
There are many things.
A lot of things that we've been
there are
thinking
many
about.
things we need to pay attention to. They are very, very important. And I really love the idea is because instead of squeezing young stroke survivors into existing system, you are creating something that genuinely works for them. And I think it's very powerful and very amazing. Let's look at again physio's perspective, because I'm a physio, you are a physio, and most of our listeners are physios. And as a physios, we are right there in the thick of rehabilitation, but working with younger stroke survivors often calls for a slightly different mindset within this model, in your model. What role do physiotherapists play? And from your physio perspective, what makes rehab for young stroke survivors different, or maybe a bit more nuanced as your clinical experience?
Yeah, that's a lot of things to think about. In terms of our model, our 2 different models, the one in Victoria doesn't employ a physio, or does not employ physiotherapy services per se. So we've got physiotherapists working within the service. But in Victoria, maybe if I explain the models a little bit, that will help to explain why would you not have a physio in a health and a rehabilitation service. So I'll just take a little bit of a step back as well, is that because within the young stroke service, it's a pilot study, and we're looking at different models of care that might be suitable. As I mentioned before, we don't have we're not seeking to support everybody's needs all the time. So we were an adjunct to the existing services. So when we know that somebody, or when people are referred into us, we do a screening and an intake interview to find out what are their needs, and those intake interviews currently are done by a physiotherapist, a very skilled physiotherapist on our team, but she doesn't actually treat people if they do have if they do have needs related to physiotherapy. But she uses a lot of her physiotherapy clinical reasoning when she goes into the multidisciplinary team meetings, and then back to the patient discussions to help the person with their future planning and their care pathway development. And so the pathways of care may be developed so that they are referred to see a physiotherapist or our neuropsychologists, for example, or a return to work and vocational rehab program. In South Australia, they've got a different model where where it's actually established, it's being run within a health service, and they do have physiotherapists who they can refer into. And so it's a different model, and we're learning the pros and cons of each of the different models and the different approaches. That explains why we don't always have a physiotherapist within our stroke certs. But in general, within I see the roles for physiotherapists, it's a very strong role. And as you said, we really get very connected to patients. We often spend a lot of time with patients throughout their recovery. It might be for weeks or months or even years potentially, depending on the context. And so I think that there's a lot of scope for physiotherapists as well as other multidisciplinary team members to really be able to take a step back and really make sure that we're seeing somebody for their whole person and their whole situation, and to just be making sure, be really mindful of not just focusing on the physical, but be checking in with all of those other potential needs that we have been talking about, and take lead from conversations that we might have with patients as well. If they're talking about their parenting, or if they're talking about wanting to return to work or get back into studies, or just to be really thinking about how we as a physio who have heard this information, what can we do with that to help somebody build their recovery? And as stroke survivors themselves have told me, it may be one person who looked at the screening tool that we had, they were like, oh gosh, I didn't even think about all of these potential issues being a potential issue. But now that I know this, I'll be able to think about it for future, or I'll be able to consider it. So I think as physios, there's a lot of give and there's a lot of take. And we're also, you need to be mindful of who else do we need to be referring this patient into if we are starting to see perhaps their mental health deteriorating, or noticing some cognitive issues, or whether we're noticing them ourselves or it's being reported to us by the patient, for example. So it's to ensure that we're referring appropriately, and including our allied health clinician colleagues as well as medical teams, and encouraging patients to have regular medical check-ins as well, medication reviews. People with young stroke are going to live a long time with stroke, so it's a lifelong recovery, shall we say.
Yeah, it's amazing teamwork, and you're helping people reconnect with who they are and who they want to become. Actually, it's a teamwork. Yay! Amazing teamwork. And it's always valuable to look at what's happening globally. I'm curious whether other countries have developed similar services and what we can learn from them. Have you come across any international examples of young stroke service models that stood out to you, and what lessons could be applied to settings like Turkey, which is my country, and the other developing healthcare systems?
Sure. To my To my knowledge, there's a few, but not a lot of health services that are dedicated for young people with stroke. And when I say dedicated, I don't mean committed, because I think that most people would be committed, but in terms of really focusing on young stroke service delivery. So that we do know that around the world it's an area of increasing interest, and there's a lot of peer-led programs, I guess, and more support and peer programs that are available, and we certainly can learn a lot from that. And we know that a lot of patients themselves do really benefit from finding their community so that they can talk to others who have been through this situation, and don't need to explain themselves again and again with some things that perhaps don't need to be explained if you know that your peer who's had stroke. Okay, let's now talk about other things, for example, but also for the value and the meaning, and to hear people's experiences from that lived experience perspective. So there's a lot of good examples around the world for peer support and social support. Clinically, there's less different models, which is why we're testing our own. But I think that what we can learn from all of the different approaches that there are is the importance of having people with lived experience helping to design and develop things, as we mentioned, and linking in really closely with existing clinical services, but also being able to take that step back and be able to look at things from a young person's lens. And I had one other thought then that popped into my head. And and of course the research. How could I not mention research in that conversation? So I think that having a system that allows a young person to navigate it themselves or with the support they need. So it's patient-driven, patient-focused, but it's expert clinical care run by or provided by people who have the skills and the understanding and the ability to listen and learn as well as teach is very important. For it to be linked in with research as well, so we can all learn from each other and grow together rather than having to reinvent the wheels. So I love our network that we're developing up now between yourself, your team and ours as well, to learn from each other and have that relationship between the clinician and research teams as well, and having the vision, but also the humility to be able to learn from each other and grow from each other.
Yeah, yeah. That's incredibly encouraging. It really gives me hope that within the right vision and strong collaboration, especially with lived experiences, we can make meaningful change happen even in settings where resources are limited. So that's incredibly encouraging. And now let's wrap things up with a message of hope, because stroke can change life in an instant, and when it happens young, the impact can be even more profound. But hearing from leaders like you can make a huge difference for them. If you could share a message with young stroke survivors and their families and the health professionals supporting young people, what would it be?
I think that my key message is that to young people is that we hear you, and we recognize, we as clinicians and we as researchers know that there is a lot more that we together can build and we can grow. Health services are constantly evolving, and it is really important that we build clear and strong relationships with our patients, because without patients contributing to helping to design health services, we as clinicians are not doing the right thing. We really value and we really want to engage with young people who have had stroke as well as their supporters. And as one of my colleagues recently said, young stroke survivors have so much to give still in their life, regardless of who they are, regardless of where they've come from. You might not be able to, it might be difficult to communicate, it might be difficult to advocate, but we are here, we do hear. And if you feel that you're not heard, keep advocating, keep reaching out, and we're really keen, across the community to help to build the better solutions.
Yeah. What can I say? That's such a beautiful and empowering not to end on. And Karen, thank you so much for your such thoughtful and inspiring conversation. Your work is truly shaping how we think about the age-specific stroke rehabilitation, and I feel incredibly lucky to be learning from you, both as professional and on a personal level. Uh, what do you what can you say? Something maybe for our closing. Uh, do you say something for the closing?
Yes. I would like to say thank you for this conversation. I really always enjoy reflecting and sharing about such topics, and it's really exciting that there is an increase, a growing community of people interested around the world in young stroke. And I don't speak just from myself, but of course from myself and my colleagues, but people who with young stroke have been shouting for years that they need to be heard better and have more of a voice. So I hope that what we're all doing as a community now can only grow and develop. Thanks so much for giving me the opportunity to speak today. I'd really like to hear from anybody who is interested in this space, and we do have some international collaborative work that's building from this. So please, I'm sure that Aslit will have my details connected with this recording. And there's lots of resources available that we can direct people to regarding communication, inclusion, training. We've developed a guidelines. We've got from our partner, the Stroke Foundation, they've got a lot of resources and podcasts, as well as interviews with people who have had young stroke. So there's a lot of information out there for young stroke survivors. So please spread the word, and thanks for listening.
To our listeners, we'll be back soon with more conversation that put people, purpose, and progress at the center of physiotherapy. Until the next time, take care and keep pushing the boundaries of what's possible. Thank you.